Welcome to Medicare 101, what you need to know. Thanks for taking time out of your day to review this information. My goal today is to make sure you better understand the Medicare options available to those who qualify or are about to qualify for coverage. Hopefully, after this presentation, you'll feel more knowledgeable and confident in the direction you may be choosing for yourself or someone you know. This presentation is for educational purposes only, so be sure to carefully review your current plan materials prior to making any buying decisions. So a little bit about me. I have over 15 plus years of healthcare experience. I'm appointed with the leading Medicare insurance companies in 10 different states. I help people with original Medicare, Medicare supplement plans, custodial care plans, long-term care plans, and life insurance. I have 4 amazing and beautiful women in my life, my wife Amy, and our daughters Asia, Maya, and Jada. I'm an independent licensed agent, and I'm associated with Health Markets. Health Markets is one of the largest health insurance brokers in the nation, and this gives me access to over 250 different plans and national resources, so I can help educate you on the options available and guide you through the process of selecting, applying for, and utilizing your plan. Before we begin, let's make sure that we have a good understanding of the terms we're going to be using. These may be familiar to you, but I just want to make sure that we're all set on the same playing level. So first is the beneficiary. This is how individuals covered under Medicare are referred. So if you have Medicare coverage, you are referred to as a Medicare beneficiary. This is a common term that you will see on government and Medicare information websites. Premium is the bill you pay, usually monthly, to have coverage. This is a fixed cost once you have coverage. Premiums may go up when you renew your coverage, but once you are under coverage, your premiums stay the same until the renewal period. So most of you may be familiar with the term deductible, but this is a preset fixed amount you pay out of pocket before insurance begins to contribute to your medical expenses. A copayment or copay is also a preset fixed amount, but is applied to a specific service or product. For example, a plan may require a $30 copay for a doctor's office visit. Coinsurance is the sharing of costs, usually a percentage between you and the insurance company. And that's after you've paid your deductible. So once you pay the deductible, you may be responsible for 20% of covered charges, and the insurance pays the other 80%. We're going to learn about Medicare through Joan's experiences today. Joan is 64. She's preparing for retirement and plans to enroll in Medicare when she turns 65. Like many people new to Medicare, she doesn't know a lot about the program. She knows it's a federal health insurance plan that started in 1965 as part of the Medicare Act. She knows that eligibility includes those age 65 and older, those under 65 with certain disabilities, and people with end-stage renal disease. Although she also finds out that the end-stage renal disease provision is being removed in 2021. Oh yes, and there's a Medicare card as well. A highly motivated self-starter, Joan logs on to the internet and does an initial search to find out more. Joan always thought Medicare was a single Medicare medical plan, but it turns out it has 4 parts: A, B, C, and D. She learns that Part A covers hospitalization, skilled nursing, some home health care services, and hospice care. Part B, she finds out, covers her doctor's visits, preventative care, diagnostic testing, and durable medical equipment like braces, wheelchairs, and similar products. Part C is also known as Medicare Advantage, which Joan has heard of but isn't familiar with. And Part D is for prescription drug coverage. She also learns that Parts A and B are known as Original Medicare. Joan needs to figure out if and when she qualifies for Part A. As long as she has worked 40 quarters or 10 years or qualifies under her spouse's benefits, she can get coverage. Otherwise, she will need to buy into Part A. Since Joan has worked her entire career as an accountant, she will qualify under that provision. She's heard that Medicare can have some significant gaps in coverage. For example, her Part A deductible of $1,556 will cover days 1 through 60 of hospitalization. However, if she has an extended stay, days 61 through 90 have a coinsurance of more than $389 per day. And if it's catastrophic and it goes beyond 91 days, the cost is $778 per day, up to 60 additional days over the life of her coverage. Skilled nursing has an out-of-pocket as well. The first 20 days have a $0 coinsurance per day. However, days 21 through 100 have a daily coinsurance of $194.50. So Part A covers her hospitalizations and other inpatient services. Joan then learns more about Part B. Apparently, she has to pay $170.10 in monthly premiums for Part B, but that will provide her medically necessary services for outpatient services like doctor's visits, diagnostic tests, or preventative care like a mammogram. So she has to pay a monthly premium, and she also finds out that there are additional out-of-pocket expenses she could face. There's an annual deductible of $233, which is followed by a 20% coinsurance that she'll be responsible for. Additionally, in most states, providers who don't accept Medicare payments can charge an excess fee of an additional 15% of the total to balance the bill. Not surprisingly, like all insurance, Medicare doesn't cover everything. She has a moment of panic when she sees that Medicare doesn't cover prescription drugs, but remembers that self-administered medication is covered under Part D. That leads to another search. How does she get Part B, and what could that cost her? Turns out prescription drug plans under Medicare are offered through private insurance companies. To get coverage, she has to be enrolled in Part A or B, and she could face a penalty if she waits too long to enroll. She also finds out that she has options. She can buy a standalone drug plan known as a PDP, or prescription drug coverage could be included with a Part C Medicare Advantage plan. Great, a deductible will probably apply as well. But the drug list or formulary is based on a tier system. The higher the tier number, the more out of pocket. She finds out she can probably expect to pay between $15 and $100 a month for drug coverage. Part D plans have the same general structure, starting with the deductible. Joan knows how deductibles work, but some of these other stages are completely foreign to her. There's the initial coverage period, followed by the coverage gap, sometimes referred to as the donut hole, and Joan's heard of that. And finally, there's something called the catastrophic stage. Well, this sounds kind of confusing. Probably need to do some more research, right? So during the deductible phase, Joan is responsible for 100% of the retail costs for her prescriptions. Once her deductible is satisfied, she enters the initial coverage stage, where she will pay a copay, and the Part D plan pays the remaining balance. The plan will track the total amount paid by Joan and the plan until that amount reaches $4,430. Once that number is reached, Joan enters the coverage gap or donut hole. Joan will pay coinsurance for her brand name and generic drugs while in this coverage gap until she has reached $7,050. The plan will only track her expenses during the gap phase. When she clears the gap, she will move into the catastrophic coverage. During this last stage, Joan will be responsible for 5% coinsurance for the remainder of the year, with the plan paying a portion and the balance paid by Medicare. This all gives Joan a lot to think about, and to be honest, leaves her concerned. In fact, an extended hospital stay or serious illness could ruin her retirement plans, even with coverage through Medicare. She needs to find out if she has options to protect herself against all the potential out-of-pocket expenses. Joan remembers that her friend Diane enrolled in Medicare when she turned 65 last year. When Joan calls her, Diane explains she purchased a Medicare supplement, sometimes called a MedSup or a Medigap plan. These plans, Diane explains, are sold by private insurance, and they work with original Medicare Parts A and B. According to Diane, her MedSup helps cover the gaps left by Part A and B, like deductibles and coinsurance. Diane had to buy a separate Part D plan since prescriptions aren't covered by Medicare subs. Joan asked if she knows about Part C, Medicare Advantage, but Diane explains you can have a Med Sup or a Part C, but not both. So are all Med Sups basically the same? So if you review the table and the variety of plan types available, for the majority of individuals looking at a Medicare supplement plan, plans G and N are the columns to focus on. Medicare supplement plans are run by private companies, but they must follow the Medicare guidelines. That means it doesn't matter which company you select to administer your Medicare supplement. Every company must administer the same benefits for each plan category. Plan G covers everything except your Part B deductible. Plan N does not cover your Part B deductible or any Part B excess charges. Plan N also includes a $20 copay when you see your doctor and a $50 copay when you go to the emergency room. Benefits and costs may vary depending upon the plan chosen, so you should take the time to pick a plan that best meets your needs and your budget. Joan feels a lot better after talking to Diane about Med Subs. Before they hang up, Diane tells Joan to call their former coworker, Phil. Phil has a Medicare Part C or Medicare Advantage plan and can tell her how that could be another option for coverage. When Joan calls Phil, he tells her that she can get a Medicare Advantage or MA plan from any number of private insurance companies. Medicare Advantage plans include all of the benefits of Part A and B, and some plans include Part D coverage for prescriptions. They're known as MAPD plans. These plans may also have additional coverage for things like hearing, vision, wellness, and more included with the plan. In a search for plans in her area, Joan finds that most of the plan options are HMO and PPO plans. Regardless of her choice, she has to maintain her Part B coverage, and most of her services would require a copay or coinsurance, kind of like her plan through work. Excuse me. She also finds that many plans have a low or even zero monthly premium and have a maximum out of pocket to reduce her risk of major bills. So cost may concern Joan. With a Med Sup, she'll pay her Part B premium along with a monthly premium for the Med Sup coverage. However, she'll have little or no out-of-pocket costs when using the plan. She also has to pay her Part B premium with a Medicare Advantage plan, but those plans usually have much lower or even $0 premiums, but she would have to pay copays and coinsurance when she uses the plan. Joan has a lot to consider before enrolling in Medicare. She's not sure that what she'll do yet. She could take original Medicare, that's Parts A and B, consider a Medicare supplement plan, and then purchase a Part D plan to cover her prescription. Or she could enroll in a Medicare Advantage plan. She might find one available with Part D coverage included. If she doesn't find one that includes Part D, she'll need to add a standalone plan. She remembers that she can only choose a Medigap plan or a Medicare Advantage plan, not both. To get some more information, Joan attends a Medicare educational event to see if there are other ways she might save on Medicare expenses. First, there's Medicaid, which helps pay some of the costs not covered by Medicare. Medicaid may also provide some benefits that are not covered by original Medicare. Then there are Medicare savings programs. If she qualifies for one of the programs, she can use those funds to help pay for Medicare Parts A and B costs, like her premiums, deductibles, copays, and coinsurance. And then there's extra help for low-income subsidy. It helps to pay for Part D prescription costs, such as planned premiums, deductibles, coinsurance, copays, and coverage gap expenses. Finally, she learns there may be additional resources through a state pharmacy assistance program and even through drug manufacturers that offer patient assistance. Along the way, Joan learns that she can get Medicare coverage anytime she wants. When her 65th birthday gets closer, she can initially enroll during the 3 months before, the month of, and 3 months after her birthday. Also, each year, she can make changes to her coverage between October 15th and December 7th. This is known as the annual enrollment period, or AEP. That's probably when she starts seeing all those commercials on TV. She can also make a change if she has a qualifying event or a recognized life change outside of the AEP, like moving to a new area where her plan doesn't participate. To find out more about Medicare, you can visit medicare.gov or call 1-800-Medicare. You can also visit the Social Security website or call 1-800-633-4227. And always feel free to reach out to me at 602-551